also have to keep your inner army strong. Your inner army has a physical, mental, and emotional component.
I was used to hospitals in the United States with shelves of supplies, bags of blood, and many other doctors with cheesy jokes, not just one. And now I was the only frontline physician. This meant doing raids with the soldiers. I was practicing out of these vehicles and had a backpack of supplies, and that's it. And sometimes you have to be thrown in these difficult situations to see things through a different lens.
Before me was a man standing 6'1", a man who was responsible for the death of thousands of people. Saddam Hussein, the former president of Iraq, was my next patient. Often under these pressure moments, whether eyes are on you because you're treating a dictator or you're treating someone who injured your friends, you have to stay objective and accomplish your mission. And I think the military does a great job of teaching that. And in medicine, it's the same way.
It's a mile-an-hour turn. And...
Were you wearing a helmet?
No.
Did you hit your head?
No.
Tell me everywhere you're hurting right now. Dealing with trying to suppress emotions, taking care of patients when there may be your emotional primitive brain may be telling you something different. You have to just rely on that cortex and that inner army to just kind of fight those primitive impulses so you can do your job. I mean, medical providers do it all the time.
We've heard about the distancing, we've heard about washing your hands, and the other thing is basically knowing when to come to the emergency room.
So if you think you're sick, stay at home. And this was shown to be effective for the people who did this during the SARS epidemic. Instead of standing in line to be screened where you can catch SARS from others, stay at home if you're not that sick.
Our days may be intense, but decompression is important. And I'm so grateful to all the respiratory therapists, nurses, and all the team first responders, the custodians who probably save more lives than anyone by killing germs. I mean, this is a team effort right now. In this world of doom and gloom, we can be empowered by what we know. And that's what helped me in Iraq. From my Iraq experience in these intense moments, you see such acts of heroism and just amazing human spirit coming out. And we're gonna see that here too.
Dopamine's a feel-good substance. It's our reward system. So essentially, a lot of our decisions under pressure are whichever option releases the most dopamine. But following those dopamine surges can often lead to just bad decisions, stupid decisions.
To go through war, blood, tears, sweat, pain, to bring peace to a region of the world sometimes. And our body is the same way. We have to go through pain. We have to go through rehab, surgery, to bring peace to that region of the body.
Your emotions, they're ingrained in us. Fear of loud noises, fear of falling, fear of threat. But what you can control is your actions from those emotions. So you call the general, the frontal lobe, deploy those inner army soldiers to master that clear space between emotion and action.
Because these decisions under pressure, these decisions lead to habits. And habits lead to character. Your character.
I'm Dr. Sudip Bose. Keep your inner army strong.